I get emails every day from solicitors wanting to help me maximize revenue. And that's what hospitals, that's their business model. That's really what they're all about. My model, and the one I champion, is maximizing delivery of value. That's why I love the name of your podcast, because it really is about maximizing delivery of value. That way, the exchange is voluntary. It doesn't feel like a drive-by shooting. And we have a lot of repeat customers.
Welcome to The Voice of Value, the podcast that delves into the heart of business and explores the value they bring to the world. Your host is Dr. Roger Moczygemba, a direct primary care physician and a visionary entrepreneur. Each episode, he'll be talking to business owners and leaders from a variety of industries, discovering their unique stories and understanding the impact their companies have on their customers, employees, and communities. He'll also uncover the secrets to their success and learn how they tackle challenges in today's fast-paced world. So grab your headphones and join us on this journey as we explore the essence of value in business. This is The Voice of Value.
All right there. Well, I'm so excited to start this episode of the Voice of Value podcast. The purpose of this podcast is to give the guest an opportunity to explain or show how their business provides value in the community, and then also to give the guest an opportunity to describe how they got to their current position of providing this value, and then just to discuss principles of business in general, because without value, a business wouldn't exist. So today I'm super excited to have Dr. Keith Smith join me. I'm Dr. Roger Moczygemba from Direct Med Clinic. Dr. Smith, I'm going to call you Keith. Is that okay? It just sounds more natural.
Fine with me.
Okay, great. So Keith Smith was born and raised in Oklahoma and went to medical school and then did his residency in anesthesiology. And then in 1997, Keith, with his partner Steve Lantier, started the Surgery Center of Oklahoma. That was in 1997. And it has absolutely grown into a beacon for affordable healthcare for the whole country. It's an example that other surgery centers are duplicating, which is a good thing. And then also, Dr. Smith founded another organization with co-founder Jay Kempton. That's the Free Market Medical Association, which is having its 10-year anniversary this year. So we'll give him a chance to talk about that as well for a minute, with especially with the annual meeting coming up next month. So perhaps, Keith, we could start talking about how you got started on this journey, the journey that led you to founding the Surgery Center of Oklahoma.
Well, thank you, Roger, for having me and for everything that you do individually, and also with the San Antonio chapter of the Free Market Medical Association. There's no doubt in my mind the value that that you're creating with all that you and your team are doing. So thanks again for having me. So as an anesthesiologist, I started practice in Oklahoma City in 1990. And it wasn't long after I began practicing that I realized that the arrangement, both medically and financially, between the big hospitals where I worked and the patients I anesthetized was not one that could be characterized as mutually beneficial. Patients having procedures as simple as tonsillectomies or carpal tunnel releases were essentially being bankrupted by hospitals that claim to not make a profit. And I was complicit in this arrangement. I was essentially an accessory to a crime. And I realized that patients that were entrusting at least their anesthesia care to me had no idea what I was going to charge them for what I was doing. And to be fair, I didn't know what I was going to charge them for the service that I was going to provide, because I'd really not thought about my practice in that way. I read a fair amount of economics by the time I got to this position in my life, even then, right at 30 years old. And I had come across a brand of economics which has been vindicated, called the Austrian School. And the Austrian School really was founded by a fellow in Austria named Karl Menger. And he was the first to describe value in a way that I believe made sense. Up to that point, people thought that value was objective, that even Adam Smith and economists much later on thought that value was determined by the labor and the materials that went into making something. So the value that a table or a chair represented had something to do with the amount of material or labors that went into it. This is the cost sort of idea behind value, and that underlies and undergirds the Marxist view of value theory. The Austrians and Karl Menger stood all of that on its head with the idea that value is subjective. And before anybody decides that that's not true, in the United States, we often hear the phrase, well, something's worth what someone will pay for it. And that essentially is the subjective theory of value in a nutshell. So all the time in the world can be spent on building a table that is so ugly that no one wants to buy it. And so he goes to great lengths in a brilliant discussion on value, and that it is subjective. And I think that's relevant for your podcast, because I think as physicians, we succumb to the idea that, I went to school for so long, and I went through all of this training, and therefore the service that I provide, the service that I sell, should command a high price. And that is really flirting. That is really flirting with an objective sort of view of value. The truth is, the service that physicians provide is also subject to this law of subjective value. The buyer needs to wrap their minds around what it is that we provide, and then ultimately the buyer determines whether they value it or not. So many times I've heard surgeons say something like, well, I use three lasers and a robot, and I spend 4 hours to do this procedure when someone else might just spend 30 minutes, and therefore I should be able to charge more, or I should be paid more. And again, that's a flaw. So in thinking, whatever the service that's being provided needs to be valued by the buyer, not by the one really that is providing the service. And then some sort of a mutually beneficial exchange can be worked out. So I came to the idea that, I need to be more in control, not just of the medical care, but the financial situation patients find themselves in, or I will always be an accessory. I will always be part of the injustice of this mess that we call the American healthcare system. And this idea of value is really what brought me there. And I decided that I was competent. I thought, very good at what I did. And I understood, I thought, how the services that I provided should be perceived from the buyer's point of view. And so with that confidence and those ideas in mind, Steve Lantier and I launched the Surgery Center of Oklahoma in 1997. And you really have to be confident to say, here is what I do, here is what I charge for it, and market judge me. I accept whatever judgment the market imposes on me. But that was sort of the radical ideas behind the founding of the Surgery Center. And we started quoting prices over the phone the first week, really with no idea, Roger, how radical that was at the time.
Hmm. Yes, that sounds so outside the mainstream flow of things. So you are an entrepreneur in every sense of the word, and I love that. Um, and so you really put these, I mean, you had confidence in yourself and what you did in your training, and then you also had confidence in these principles. And I'm so thankful that you shared where these principles of business and where you came from. So how was that start?
Well, what I just described is not a roadmap to making friends. There were very few friends in the medical community. These ideas were too radical and threatening, frankly. But we didn't care. We had really gotten past caring because Steve Lantier and I both had very successful anesthesia practices when we walked away from them. We walked away from them to establish this facility and gain control medically, what care patients would receive, and also financially, to what they would be exposed. It was exciting. It was scary in a way. Financially, Steve and I were all in. We were completely at risk. Everything that we owned and that we could borrow was leveraged to make this facility happen. And it was a wild success. I remember our first goal was to perform 10 surgeries in one day. And I remember about 6 weeks in, when we had our first day with 10 procedures on one day. And this was very exciting because we had sort of figured out how much revenue needs to come in to cover overhead. What is our break-even point? And it was somewhere between 8 and 10 cases. And so about 6 weeks in, we started to reach that break-even point, and it was very, very exciting, very heady stuff. But it was a wild risk. It was a risky undertaking. And for it to be successful was so gratifying and so vindicating. And patients were so grateful, and they didn't mind at all having conversations about money. That was one of the this principles of our founding. Was we decided no patient will arrive at our facility without knowing what they're going to pay. We always had those conversations up front. We decided it was deceptive and was a deceptive business practice to only spring on patients what they owed us after the procedure or services had been rendered. So we decided early on we were filing out-of-network insurance claims, but we told patients up front, this is what you're responsible for. This is the amount. And we always told them that up front. So it was frightening. It was, but after just a few weeks, it was very gratifying and vindicating, really unlike anything professionally that I'd done up to that point.
Wow, that's great. So thanks for sharing that. 6 weeks is not a long time for a startup to start to be profitable.
It seemed like an eternity.
Yeah, it was. And then the other thing that you mentioned, I think, is really important for any entrepreneur that is listening in, is that both of you were all in. You were all in. So I've heard other leaders or business or entrepreneurs say that they've come to sometimes a place where they hit rock bottom, and that's what it took to turn things around. I'm glad that didn't happen to the Surgery Center of Oklahoma. And then another thing you mentioned was the gratitude from the patients. In this world of direct pay, me and my clinic, we experience that all the time, and it's so gratifying to practice medicine this way, to have this direct relationship with our patients. Um, Another thing that I realized a few years ago when I started Direct Med Clinic is that, and then started the San Antonio chapter of the Free Market Medical Association, is that we live in a free country. We talk about free enterprise in our free country, but we do not have a free market in healthcare because there's no price transparency.
People think that the free market, has failed in the practice of medicine, and what they don't understand is that it's not operational at all, except in the sphere of outfits like yours or mine. Fortunately, that is a growing enterprise, as is mine. If what we're witnessing and what everyone hates about the American healthcare system is not a failure of the free market; it's an absence of the free market. When a restaurant serves awful or poisonous food in a free market, they go out of business. In the current system, if a hospital provides horrible or poisonous service, they get paid more for the complications they treat as a result. So rather than have consequences, poor care actually renders more revenue. So the incentives are completely upside down. And so it's an absence of market principles and discipline that I argue that results in everything about the American healthcare system that people hate. And it really is a socialized, heavily regulated system in the United States. It's not a free market at all. Over half the patients in this country, are under Medicare, Medicaid, TRICARE, Indian Health. They don't even care what it costs. They have no sticker shock. It's only, for all the complaining, only about half the people in the United States even care what their care is actually going to cost. But that's a lot of people. Half the people in the United States is a whole lot of people who do care. And so I think the time has come. It's long overdue when physicians and those in control of medical facilities say, here's what I do, here's how much it is. Unlike a lot of people, I believe it should be voluntary. I don't believe the government should make people reveal their prices. I think the market should be free to destroy those who don't.
I think in a way that's happening these days. The more that the government tries to control health insurance, the more people are pushing back and saying, no, I can't do that, and then they seek out direct primary care or a surgery center like the Surgery Center of Oklahoma. So I believe that's going on these days.
Yeah, it's growing organically. There are very well-intentioned people that are trying to empower this movement with the force of government. But I always worry when the government rides in and says they're there to help. But there is a real organic force that is causing this movement to grow. And the Free Market Medical Association and its growth is a manifestation of that success with, I think, 36 state chapters. Yours in San Antonio, it's one of the largest and most active. So there really is, it is growing organically in a really healthy way. We just have to be on guard for those in the government that would write in and try to help or take credit, because oftentimes with government help also comes control or some favor that's expected in return.
Exactly, some trade-off for
Right.
that. And I don't like to hear people talk about how healthcare is so expensive. What they really mean is health insurance is so expensive. Healthcare is not expensive because I've been providing healthcare, direct primary care, and it's affordable for people in a direct way. And you're doing the same thing with Surgery Center of Oklahoma and showing all of the prices that the surgeries will cost. And people can come from all over the country and from Canada. They do to Surgery Center of Oklahoma. Why? Because it's affordable there, right?
And available. And I could charge quite a bit more than what I do at our facility, and I've been asked why I don't, because really the compared to what price is what the price gouging hospitals charge for the same procedure or service. We don't charge more because our goal from the very beginning really was missional. It was an attempt to make care available to the largest number of people possible at a price where we had a very slight marginal profit. So, the hospitals typically charge 6 to 10 times what we have listed online. Now, what we have listed online is less than half what Medicare pays these so-called not-for-profit hospitals that supposedly are going broke, with what Medicare is paying them. And what we have listed online is actually less than what Medicaid pays these hospitals. So we could charge a whole lot more than what we do, but we've chosen not to maximize our outreach to patients who pay us directly. And that's intentional. And it's part of the reason that the movement has this missional feel, not a maximize revenue sort of feel. And those really are the two models, economic models in this industry. One is how do I maximize revenue? I get emails every day from solicitors, wanting to help me maximize revenue. And that's what hospitals, that's their business model. That's really what they're all about. My model, the one I champion, is maximizing delivery of value. And so that's why I love the name of your podcast, because it really is about this whole movement is about maximizing delivery of value. And that way you have repeat customers. That way the exchange between the buyer and the seller is voluntary. It doesn't feel like a drive-by shooting. It feels like a mutually beneficial exchange. And we have a lot of repeat customers.
I feel like the greater the value proposition in the marketplace, the more that business is going to thrive.
Yeah, and then Walter Williams, the great economist who's passed away not that long ago, he described the exchange, the different ways that people can exchange. One method of exchange is where one party benefits at the expense of the other. The other is where both parties mutually benefit. So his point was that if you have a gallon of milk and you want $2 for it, and I want that gallon of milk, then I'm willing to part with, and I value my $2 less than I do the gallon of milk that you are selling. You likewise prefer to have the $2 that I have to the gallon of milk that you're selling. Otherwise, the exchange does not take place. So he called that method of exchange, or characterized it as seduction, where I make you feel good, you make me feel good, both parties walk away actually enriched, better than they were before the exchange. The other type of exchange is you give me that gallon of milk, or I'm going to strangle you. And that is a different type of exchange, a coercive one, where one party benefits at the expense of the other. That is government. That is how government operates. And that is how this medical system operates, because you don't have a clue what you're even going to pay until the service has been rendered. So I prefer mutually beneficial exchange where both parties are actually satisfied at the end of the exchange and are glad and enriched actually that the exchange occurred.
Great. So we were talking about price, transparency, and value. Could you talk a little bit about what's coming up next month with the annual meeting of the Free Market Medical Association, and talk about what you're excited about there? And then maybe we can, after that, we can wrap up by maybe commenting on giving a tip for somebody that would like to practice this way, or for some entrepreneur to get started.
Well, Jake Kempton and I and the whole team are very excited about the Free Market Medical Association annual conference next month. The details, if you're interested, are at fmma.org. It's April 10th through 12th, and it's our 10th year. So we've described it as a bit of a nostalgic victory lap. The theme is Back to the Future. Our future, we think, will be great if we're a whole lot more like we were in the past, prior to all of the state and government intervention that has delivered this mess that we refer to as the American healthcare system. Mm-hmm. So it's very exciting. A lot of the original gangsters will be there, people who were at the very first meeting, and so it'll be a truly wonderful, inspirational, get your batteries charged kind of experience, and we are very excited about that. I think if I were going to give a tip to anyone getting started, it would first of all be to encourage them to honestly ascertain their abilities. If someone is involved in the medical industry and they are delivering medical services and they are not really, really good at what they do, the market will be unkind to them. Market discipline is not anything anyone should embrace if they are not really good at what they do. People ask me all the time, how do you measure quality? That you can exist or thrive in the midst of market discipline is all the measure of quality that you need. Because if you really have subjected yourself to market discipline and you're not good at what you do, you will go away. So I would encourage any individual that is flirting with the idea of jumping into this movement to be sure they really are confident with their skills and what they do, and then go for it and go all in, and be prepared for the most exhilarating and vindicating experience of your professional career.
Excellent. I appreciate your sharing that, because it supports, it's sound principle, to be confident in what you do and go out there and let the market support you.
That's right.
And so I'm super excited for next month, the annual meeting. I'll be seeing you there, and we'll put a link to the event in the show notes of the podcast. So I want to thank you so much for being on this podcast and starting with sharing the principles that got you going, and that you stand on and that you prove so well with Surgery Center of Oklahoma and the Free Market Medical Association. You're just an example of how healthcare is affordable, and really just thank you so much.
Thank you, Roger. Appreciate that.
All right. Well, we will see you next month.
Okay. Thanks for having me.
You bet.